Hello, I'd like to talk with you today about how you address concerns that you have when a family member is resistant to what you have to say. One of the first phone calls that came into my office when I started doing this was a phone call from a fellow who said, "I'd like you to visit my mother and stepfather, but my stepfather will not let you in the house." So, not one to resist a challenge, I decided to visit Ray and Loretta. Ray greeted me at his front porch, and I introduced myself and said, "Ray, I've been asked to come and visit you and your wife. I want to tell you that whatever I tell you will be the truth. You might not always like what I have to tell you, but I will be honest with you." And that opened the door for me and Ray and Loretta to have a good relationship. And that principle has guided me throughout my work, is being truthful with individuals. Even when the truth is painful to hear, it's really important to not shy away from being honest. What I find most of the time is when people are resistant, their resistance comes from a sense of fear. From Ray's point of view, he was concerned that decisions were going to be taken out of his hands. He was facing a crisis, and he was concerned that if he gave an inch, somebody might take a mile. It's not uncommon for older adults to feel like if they accept some bit of help, that they're opening Pandora's box and they'll lose control. So keeping that in mind and trying to figure out what is the source of the resistance, what is the fear that might be behind the resistance, can go a long way to unpeeling the onion and understanding what's going on with the individual. I'd like to talk a little bit more specifically about how do we help people move forward and make necessary changes, understanding that the fears that people have can be alleviated through honest conversations and a listening ear. We want to communicate to individuals that we work with, "I'm going to be doing things with you rather than to you." And how you communicate will get that message across. Sometimes resistance is used by family members who are wanting to make changes that the older adult is not ready to make. And again, individuals who are capable are able to make their own decisions, whether or not the family agrees with those decisions or not. So whether it's truly resistance with all its negative connotations, or it's the older adult saying, "You know what, it's my life and I want to make the choices that I'm capable of making," is something to consider. And figuring out what that label really means and whether it's an honest definition of the situation or whether it's the frustration on the part of a child who wants their parent to move in a particular direction is something to explore. So I talked about honesty as being a principle, and that is a matter of sitting down with mom and dad and having conversations that honestly express concerns without forcing the issue. The other thing is, when wanting a parent to make a change, I like to think of moving forward with seed planting conversations. Most of the time when you think it's time for dad to move from the home, dad is not ready to move from home. And it can take months and sometimes even years for readiness to occur. And that doesn't mean that you avoid the conversation, but look at the conversations more as seed planting events and opportunities. When having conversations, the key in my mind is, number one, listen to what the older adult is saying. It's very often for family members, because of their own fear, to say, "Dad, I think you need to do this," rather than asking questions. "What do you think about this, Dad? Have you considered that?" And really listen to the response. So rather than dictating or offering one's opinion, eliciting the opinion and the feedback of the older adult is very important to opening a dialogue. So when you're asking the questions and you're listening, what you really want to also get at are the feelings that are associated with the responses. Whether it's fear, whether it's a sense of loss, Trying to understand what are the feelings behind the words can be really instructive in moving the conversation forward. Another important piece is trying to leave your ego at the door. Sometimes we become very invested in an outcome. And so understanding that there often is not one right way of coming up with a solution. There can be many solutions. There can be many different directions that individuals can take. So be open to other possibilities and not stick to your particular idea of what should happen. The other important piece is to involve as many family members as possible in conversation. You don't necessarily want everybody in the family to be talking with mother and dad about a particular issue. You might choose as a family that somebody's going to be a more effective spokesperson than another. But as much as possible is getting everybody in the family on the same page about what is the direction that we want to take, understanding that the older adult, as long as they're capable, is the central decision maker. Finally, it's important to recognize that values can impact decisions that we make. A child's value may be very different from their older adult parents' value. So as a child, I might be valuing safety above all other considerations, while the older adult may value their autonomy. Understanding again that there's not a right or a wrong, but it's important to recognize what the differing values might be and then have an opportunity to reconcile those values. Very often in healthcare, as a nurse, I know that we value safety above everything else. And that's not necessarily the case for the older adults that we work with. Making decisions with a clear idea of what are the benefits and what are the risks are going to put people in the best position to make the decisions that's right for them and their family. My point of view is that older adults, as long as they're capable, can make their own decisions. Those decisions, however, can have a negative consequence for family members who might be called upon to help the older adult maintain the status quo. Recognizing that the older adult can make their own decisions doesn't necessarily have to translate in your taking on more roles in order for them to maintain what they want to maintain. It's perfectly legitimate to say, Dad, I respect your desire to stay in the home. I also want you to respect that I'm not going to be available to go grocery shopping. I'm not going to be available to do the household repairs. So give Dad the benefit of making his own decisions, but also understand for yourself what your limits are in maintaining what he wants to be able to maintain for himself. Just as Dad is entitled to his decisions and his life, you likewise are entitled to your decisions and your life. So when a situation becomes somewhat untenable and more difficult for the younger adult, understand that very often between a parent and an adult child, there's a dance going on. And in order to change the dynamic, somebody might need to leave the dance floor. And so setting a limit might be your way of leaving the dance floor. Dad may be able to compensate in whatever ways that he can, and that's terrific. But you don't have to continue a dance that's not good for you. Resistance can come when an older adult is not ready to make a decision that other people think they ought to be making. It can also come when individuals have dementia and are not able to make their own decisions and don't have the insight because of their dementia to understand what their limitations are and what their needs are. That requires a very different approach. Honesty is still very important, but as the poet Emily Dickinson says, give me the truth, but give it to me in halves. So you want to be honest in what you're saying to the older adult, but you don't necessarily have to catalog all the concerns or all the steps that you are taking. What you tell them is honest, but you don't have to tell them the total story. The other piece is, again, listen. Listen to the concerns and acknowledge the feelings. However, it's important to avoid over-explaining. Very often when painful decisions have to be made for somebody who has dementia and the older adult is resistant, the family tries desperately to get mother to understand. And the reality is that they can't understand. Their dementia is interfering with their ability to reason. So going on with a lot of explanations and the reason behind decisions is a frustration for the adult who's trying to make the change, and also can fuel the resistance, because the more you enter into a dialogue, the more the older adult gets revved up to counter and to resist. So keeping the message respectful, keeping the message simple, and sometimes it might be a matter of saying, yes, Mom, I know you feel that way, and then leaving it. Or, Mom, I'm sorry that this has to happen, and then leaving it. Because trying to get them to understand the change that's necessary will be futile and may cause more pain. It's also important not to react. So give a simple explanation and try to understand that it's the dementia that is speaking. It's not the older adult that you necessarily have known all your life, but it's an individual who has needs and is not able to react as the adult that they once were. So don't overreact, listen, stay calm. When needing to make a necessary change, look at taking baby steps. You might decide that it's important for mother to have somebody in her home a few days a week, and mother is totally resistant to that idea. Sometimes if you say, Mom, we're going to try it for 2 weeks, and after 2 weeks, we'll revisit it. So the person is understanding that there is a finite timeline. Very often, after 2 weeks, everything is going swimmingly. So if you can try to give it to the person in small chunks, that's an easier way for them to accept it. Sometimes, however, that's not the case, and the resistance can be such that you need to employ professionals. We always want to look at a behavioral approach, so listening, talking, redirecting, trying things in small stages is the first tack to take, but there can be times that medications are required because, again, the older adult is just not able to accept a reasonable explanation. So we oftentimes will call upon physicians to help with medications that, as we see it, help the older adult accept the care that they need. Conflict and resistance are part of life. We don't measure success by whether or not one has conflict. We measure success by how healthfully an individual is able to manage conflict and resolve the conflict and move forward to remedy a difficult situation.